Hello, I'm the Hartsville, Trousdale County Mayor Stephen Chambers. I'm here with our Emergency Management Director Matt Batey, and we're here to give a status update on the coronavirus in Trousdale County. At this time, there are no confirmed cases in Trousdale County, so I just want to reiterate that there are no confirmed cases. Any rumors to the contrary are false. I do want to provide a status on the opening or closing of any of the county buildings. The Senior Citizen Center is currently closed. It will reopen on March 31st. The library is closed to anyone wanting to come into the building. However, they are still providing curbside service for anyone who's wanting to get a book or any kind of crafts package. The school system is currently closed until March 31st. The county jail is closed to any visitors, though they are still having video visitation through a system they put in place previous to this outbreak. The administration building is open. However, we do ask that anybody that conduct their business online or over the phone or through mail to please do so. We are screening visitors to the building to make sure that we don't have anyone who's potentially infected come into the building. And at this time, I'm going to ask Director Batey if he can kind of go over some of the CDC's guidance related to the coronavirus.
Thank you, Mr. Mayor. Right now, we're looking at how EMS is operating and how it will function if you should call us. So the steps that we have taken so far to try to mitigate any infection or cross-infection, all employees are being screened prior to shift and during shift to ensure nobody has a fever of greater than 100.4. We're screening dispatch calls, so if you are to call 911, you will be asked a few questions about whether you've traveled out of the state to a state with a high-risk population, traveled out of the country to a country with a high-risk population, if you've had a fever, cough, or shortness of breath. So these are all indicators that we're using to protect ourselves and to protect the general public while we care for you. We also ask that if we respond and you are able to walk, that we will come inside your house, and we're only going to bring one person in so we can try to limit the contact between the two crew members. So we will place a mask on you. We will also wear masks, goggles, gown, and gloves. So don't be alarmed by how we look when we get there. That's just a CDC's standard operating protocol right now for possible or potential exposure mitigation for EMS. We will also notify the hospital, and before we get there, they will probably meet you outside and do another screening. It may provide another mask and gown for you before we take you inside. Right now, we're asking that everyone follow the CDC and State Department of Health's guidelines on reducing transmission of this virus. If you could please avoid all public places at all costs. If you have to go to the grocery store or go out to the general public, try to maintain the social distancing. So 6 feet or greater is the recommendation still currently. We want you to, if you sneeze or cough, to make sure you cover your mouth and nose. And the technique that's still being advised by the Department of Health is to sneeze or cough into your elbow so you can avoid contacting your hand. So if you get your hands, you can still keep them uncontaminated. Wash your hands often, and every time you go somewhere or touch something, if you have hand sanitizer, it's greater than 60% alcohol, that's sufficient to kill the virus. So make sure you're cleaning your hands. Try to avoid touching your face. Gatherings of greater than 10 people are being discouraged. So if you're having church or other gatherings with your family or friends, if it's going to be more than 10 people, and you're a high-risk population, so right now that's like 60 years old with underlying health conditions, just go ahead and try to reschedule those for a later date. And if you could, just be careful when you're out in the public, stay home as much as you can, stay hydrated, and stay safe.
Yeah, I'd also like to stress at this time, the CDC guidance is geared towards mitigation. It's nothing to panic about. It's just recommendations to try to slow the infection or prevent infection to anyone out in the public. And I would also like to take this opportunity to thank the local businesses that have already voluntarily complied with the CDC's guidance. They're only doing it for your protection and theirs, and I greatly appreciate them taking those steps and being proactive in that area. I also want to stress that for the local businesses, especially grocery stores, gas stations, those kind of things, the national supply chains are currently operating fully. They have not been disrupted in any way, so the businesses should be able to restock their shelves and replenish overnight, so there shouldn't be any issue with being able to get any item that you like at this time. So again, this is just for informational purposes. We just want everyone to be as informed as they can be. Just know that these standards are in place to try to prevent spread of the infection And again, I want to stress in Trousdale County, there are currently no confirmed cases of coronavirus or COVID-19. So please continue to follow the CDC's guidelines. And if you have any further questions, you can go to the CDC's website at cdc.gov. You could also search for the Tennessee Department of Health's website, and they have a coronavirus information page. And also, our new county website is up and operating, and it's trousdalecountytn.gov, and we do have a page for some more information on the coronavirus. You can click on that, and it'll also give you links to the CDC and the state's website. So thank you very much for watching this video, and thank you for everyone who is participating and helping, I guess what they call flatten the curve. That's kind of what we've got to do at this time. But again, I just want to stress, there's no reason to panic. These are just precautionary measures, and we just appreciate everyone following by those standards. Thank you very much.